Good morning, all of you. Myself, Dr. Nida Ahmedi, and I'll be speaking on the topic A Telltale of COVID-19 Myopic Epidemic. There is no financial interest. The development of myopia is influenced by both genetic and environmental risk factors. The usual progression of myopia in myopes between 6 to 11 years is approximately 1 diopter per year with 0.3 mm of yearly axial elongation, and in between 12 to 16 years, it is approximately half diopter per year with 0.17 mm yearly of axial elongation. The adoption of digital smart devices constitute a new form of near work wherein children spend prolonged uninterrupted period of time with closer viewing distance than the conventional books. During COVID-19 pandemic, proliferation of online classes and recreational activities has tremendously increased the digital screen time among the children. Thus, we aim to study the effect of digital screen devices on progression of myopia and evaluate the changes in the axial length with myopic shift. It was a prospective observational study of 1.5 year duration conducted between September 2020 to February 2022. All school-going children with physiological myopia between the age group of 15 to 18 years were included, and children with refractive error, amblyopia, strabismus, retinal and congenital disorders, etc. were excluded. A total of 196 children were taken up after satisfying the inclusion and exclusion criteria. Written informed consent was taken, data was collected through structured questionnaire, and average daily time spent using different devices were quantified by self-reported estimates. A comprehensive ophthalmic examination, including uncorrected visual acuity, cycloplegic refraction, slit lamp, fundus, and axial length measurements was done, and patients were followed up after 6 months. Coming to the results and discussion, there was no significant difference in age and sex distribution among the study population. The mean age was 11 years. The most common type of devices used were of handheld types because they were more convenient, portable, handy, has application for everything, and using them for games and social media was relatively easy. The mean screen time was approximately 6 hours, which can be attributed to the digital education system and increased recreational activities during lockdown. Similarly, Mary et al. Showed that mobile exposure of more than 4 hours per day, and Hansen et al. Showed that more than 6 hours per day were risk factors associated with progression of myopia. It was found in our study that out of 196 children, 172 had progression of myopia. Among these 172 with myopic shift, it was beyond physiological limit in 127, and maximum of them had axial type of myopia. The mean screen time was 6.45 hours. The mean change in spherical equivalent was minus 0.87 diopter, and the two showed a positive correlation with R value of 0.58. Similarly, Foreman J et al. Also showed that more the duration of screen time, more will be the progression of myopia. Further, the mean change in axial length was calculated, which was 0.25 mm plus minus standard deviation. A positive correlation was found between change in axial length and change in spherical equivalent, which were consistent with the finding of Zhang X et al. In his latest study. Thus, I would like to conclude that excessive usage of digital screen time during COVID-19 pandemic has accelerated the rate of progression of myopia, with axial elongation being the major component. Thus, digital screen time can be a modifiable risk factor, reduction of which can prevent the anticipated myopic epidemic. Moreover, axial length measurements can be used to monitor the progression of myopia and determine the risk of associated pathologies. Thus, regular screening must be done at every 6 to 12 months, not only with cycloplegic refraction, but also with axial length measurements. Plus, a measure should be taken to limit the screen time to 2 hours per day.